So we're going to be talking about different strategies to enhance exercise adherence. Last time we talked a lot about what the problem is and found that over half of the people that start an exercise program drop out within 6 months, and we talked about special considerations for you that are going into therapeutic exercise and the challenges for people who are also ill or have had an injury. So let's take a look at what some of these strategies are. Now these are 6 categories, but you may have some of your own as well. So this is not intended to be the only 6 types of things you can use. Behavior modification approaches we'll talk about and in depth in the upcoming slides, as well as reinforcement approaches. A lot of these things you probably already use, but maybe didn't know that they could be categorized as such. Cognitive behavioral and decision-making approaches, different ways to utilize the thinking mind. We always think that change is just about choice, but I hope that you're beginning to see that there are aspects of our environment, our upbringing, and things we're learning in social psychology that do influence our behavior outside of cognitive choices. We've talked about the importance of social support, and there are ways that you can modify that to assist your clients and patients toward their long-term goals. And then there are, as a category, called intrinsic approaches that we'll discuss shortly. So, category 1, the behavior modifications. These you're very familiar with in this building, looking at the little signs right by the elevator. Hey Reb, encouraging you to take the stairs. So these are considered prompts. So they can be verbal prompts, signs, physical, symbolic cues. Remember that symbolism can be very specific and external, or it can just be implied. And this way, hey Reb is hopefully giving us a sense of authority. I don't know how authoritative hey Reb looks, but anyway, maybe symbolically that also has some meaning. In fact, those little signs by the elevators were created last year by Kevin Doonigan, who's our communications specialist, and he asked one of the KIN 250 classes for some suggestions. So a couple of those quotes on the elevators actually came from students like yourself. Also, placing your gym bag in the car, your running shoes right by the bed, that can be very helpful. I like that one. That works pretty well. Behavior change contracts are very beneficial, and they have been studied in social sciences. You might have your own contract and have them fill in some spaces to personalize it. You could have them write their very own. That can be very effective. And have them specifically outline what they'll do and some timelines and specifically why they're going to do it. They sign it and date it, and you can sign it as well. And it may be also beneficial if they have a friend or a family member also sign. Reinforcement. Creating charts in your place of business, or you could even do it virtually if you tend to work with people in different locations. People feel good about this. We use this a lot in yoga studios and gyms that I've worked at and run. There's a sign or a poster in the hallway. And in Bikram yoga we often have 30 or 60-day challenges, and when people are done with their class they go and they add a star or make a check or put their name, and you really look forward to that as a participant. You really look forward to finishing the class or the workout, and it's very satisfying to add that check next to your name. Rewards can be useful, but have to be used very specifically. So first, if you're going to use rewards, you have to make sure they're consistent, they're equitable, you're using them with everybody exactly the same, etc. Also, we'll find in an upcoming lecture that sometimes rewards don't act as the type of reinforcement that you hope they will, and can actually be detrimental. Also, make sure that your rewards are appropriate to what the person is trying to achieve. So if a person is trying to stay away from junk food and sugar, then it would not be appropriate to have a dinner at Dairy Queen be the reward for achieving their goals. So just use your common sense, be smart about it, and we'll talk about that more later. Feedback is very important. People need to know how they're doing, but there's an art and a science to feedback. You will learn, or maybe you already have, in Dr. Wolf's motor learning class that is part of your curriculum here at UNLV. She will talk to you a lot about feedback and the science of feedback and the art of feedback. So you need both, the science and the art. For instance, if someone is very new to a motor task, they might require more feedback. They're just learning the techniques, the skills. However, we have to be mindful that continual feedback may actually be detrimental to long-term retention or learning of the skill. Maybe a little less is more. And certainly it is found that as people become more of an expert at the skill, that they require less feedback. So again, using that rule of thumb is that less is more. In sports, there's an obvious feedback. When we make a point, that's obvious feedback that we've done what we intended to do, but this is more specifically the type of feedback you will give. A rule of thumb is to keep feedback positive and remember that they are learning, and step by step they're developing the skills. And so avoid words like should and try and other words that might imply shame or guilt. Keeping a workout journal is very effective. You may do that yourself. So encourage them to keep a written record of what they're doing, and you might have them include a column, several columns for other things, how they felt, how much sleep they got. Depending on who they are, you can fill in those blanks. Why? Well, if someone tends to relapse or has a hard time staying motivated over time, they might be able to look back and see what was going on in their world. Maybe they missed sleep, or put in too many hours at work, or started eating food that didn't make them feel good. And this might help them to be aware of what tripped them up and avoid it in the future. So looking at goal setting, you may have learned in Kinesiology 175 or in other places some tools about setting goals. And remember that we want to set long-term goals and then short-term goals that allow us to get there. So like stair steps, stepwise. In setting the short-term goals, we would like to set goals that we can reach. We can help our patients set goals that they can reach. Remember DC and Ryan's self-determination theory from the last lecture. And the second component of those three is competence. People need to feel competent. They need to feel like they can do it. And when people achieve goals, that tends to build their sense of competence. So the short-term goal should be set so that it's developing competence in order to continue developing motivation. Exercise-related goals should be more self-set than instructor set. Now, certainly you need to provide the parameters and the basics, but it may help them to develop a sense of autonomy. So looking at the self-determination theory of motivation, another basic component is autonomy. If you help to empower your client, then long after they have left your care, they may still retain the motivation to continue on their path. So having them help to set the exercise goals allows them to build a sense of autonomy. It empowers them. Being flexible rather than fixed. So you have to make sure that they're not setting a plan that is so rigid that if something goes awry, it's completely over. They have to start completely from scratch. So be aware that long-term plans often have to be modified or changed, and that's normal. So we have to set that plan in motion with already built in a sense of flexibility. whether that be something that's within the design or just an awareness that there must be some sense of flexibility. And also time-based rather than distance-based. So this is more of a fitness-based rather than performance-based. Well, if a person is rehabbing or exercising for health, then we're looking at fitness. If a person is training for the Olympics, then, well, they're looking more at performance, but that's not what we're talking about. So if you, for instance, have an easy time running 2 miles, and that to you is not a very challenging, or maybe, not an arduously challenging task, please remember that running 2 miles for another person may be significantly easier or significantly harder. And so setting a goal of running for 15 or 20 or 30 minutes may be more appropriate for a fitness goal than stating a specific mileage. People have different running styles and economies. They have different physiological and psychological components that play into their experience of exercise. And so remember to keep your fitness goals not performance-based. Cognitive techniques, they're talking in this book more about providing some type of dissociative strategy. So very simple, this could be watching excuse me, watching TV at the gym while you're on your elliptical machine. It certainly can help the time go faster as opposed to sitting there thinking about how your legs feel. Listening to music, you may not be able to imagine working out without your earbuds. So the same will fall true for your clients. You might suggest they make their own workout mix, or in your establishment, if you have a store, a place of business in your clinic, you might add some, flat screen or provide some type of music. Make sure your environment provides cues that are supportive, but also can serve as for dissociative strategies, so your people can enjoy what they're doing. So remember to involve them in decisions regarding their program structure. Developing balance sheets can be a helpful tool. Maybe your mom used to tell you to take a piece of paper and draw a line down. On one side are the pros and the other side are the cons. I don't know if you've ever done that, but it can be rather illuminating if you're struggling with making a change or making a decision. I use a version of this in my smoking cessation program, and I will tell you how I do it, and you might do it the same if you like this idea. On a piece of paper, I have a form actually. Then on the left side, the left column, it says, "Imagine you did not change." And so this would be for smoking, that you never quit smoking, that you're always a smoker. And there are 4 questions asked. And question 1 is, what is the short-term pain of being a smoker? And they list things like, they don't like the smell, the cost, the embarrassment, yellow teeth, those types of things. The next question is, what are the long-term pains of being a smoker? And that's often where health concerns come in, and many other things depending on the individual. It's always interesting because people do have different reasons, different things that come up. And then the third question is, what are the short-term pleasures of continuing to be a smoker? And this is important because we do develop some type of pleasure out of our long-term behaviors. If it was truly painful, we'd probably just change it. But we do develop comforts or perceived pleasures. So for someone who's sedentary, it's important to be honest. Maybe somebody who works out too hard, maybe somebody who perpetually overtrains. It's important to be honest about what the payoff is. What are the short-term pleasures of continuing the behavior? And then what are the long-term pleasures? And certainly for smokers, I don't recall there ever being a long-term pleasure listed in that column, but it does make them stop and think about it. And then the other side of the sheet I say, okay, you've quit smoking. Now you are free from this habit. And so, number one, what is the short-term pain? And they may write down things like withdrawals or cravings or don't know what to do with my hands, etc. Another place to be honest, so people can address their concerns before they embark on a behavior change. And then I ask, what are the long-term pains? And again, that could be a short list. The short-term pleasure and the long-term pleasure. And hopefully at this point you can see the pattern, and if a person is going to quit smoking, they can start beginning to see what some of the pleasures and short-term and long-term pleasures are. So anyway, this can be a very helpful tool, and one that you might include in a packet of paperwork that you design. And it can be very helpful to understand more about your own behaviors and what you will gain. When you look at it like that in black and white, it might help you to become more aware. Again, it's very hard to change things we're not aware of, so bringing awareness is extraordinarily helpful. We've talked about social support. You can involve a person's inner circle. Make sure that you also explain to them to avoid the words like should and try, and to make sure that if they are part of the team, that they are genuinely a positive part of the team. This is a place where you can create social support through the environment. So this might be more challenging in a physical therapy office because people are going to have their own workouts that they have to complete. So therefore you may be able to develop some social outings and picnics or potlucks, or bring a guitar player in on Saturday afternoons and people to stop by, or any number of things that you can do to create a sense of community. So that's that third component in DC and Ryan's self-determination theory, is belonging. People want to feel like they belong. So you can provide this externally even if a person does not have social support internally. And these small groups can help people to forge new bonds, feel supported, and not feel like they're alone in something that they're going through, whether that be rehabilitation or fitness. Intrinsic approaches, it depends on what the person is doing and what the goal is. So if a person is in physical therapy, the experience itself may not be pleasant, but it could be that if you can switch their thinking, that is strengthening the injured area, or that each time they come they're getting better, that may help to increase exercise adherence. If they enjoy it, if it's a Zumba class, then focusing on the experience may be very useful. Taking a process orientation, more what I was referring to in the rehabilitation setting, I'm very fond of telling my yoga students some of the positive benefits they're giving to their organs in their practice. And tell people, oh, you're helping your spleen. Well, they don't have an idea what their spleen does, but they feel pretty good that their spleen is happy. And so taking a process orientation can be helpful. I think most people, myself included until just recently, don't understand that first workout has physiological impact. That first 10, 15, 20-minute workout, your body already responds, and it's very supportive to health. So you can take what you're learning in your exercise science classes and teach people what's happening inside. What's the inside job? And this can often be very motivating, particularly if it's new information for them, and prior they've only been doing this type of thing to maybe fit into a swimsuit, or because they feel like they should, etc. It may be that they have children, in which case you can suggest that they take their kids to the park, or begin to run with their friends. This may make it a more purposeful or meaningful activity. Running with your dog, taking your dog to the park and playing with a frisbee, all of these types of things. As well, sometimes martial arts, yoga can add an additional component of mental calmness from utilizing the practice, and that can also make it a more meaningful activity than other types of workouts. All right, so there's different strategies that some focus on changing people, and that's what we've been talking about. Lots of different things we can use. There's lots of different technology is really kicking up here. You can get apps and Xboxes and all kinds of things to provide some technical help and instruction. But we've been talking about how we can basically change people. But there are also things you can do to network people. We've been talking about that. You can create an environment within your practice. You might consider adding a table where people can put their business cards, or create a database with a computer that everybody can access that is like a professional referral database. So they need a plumber or a real estate agent, that they can utilize somebody who also works out at your establishment or is your patient. You can create activity classes for families. You may have a kids' day if you have a gym or a place where you can bring the kids in. And again, involving the family or friends can be really helpful. If you have a studio or a gym, sometimes bring a friend for free day is a great way to boost adherence and also your success. Be mindful about some of this. I think a lot of it's talking about being a matchmaker, and I would caution you against that. Certainly provide opportunities, but you have to be very careful about professional boundaries. So you're going to get very close to your patients and clients. It's one of the things that happens, but you have to make sure up front that you are staying out of their personal life, except to the degree which is appropriate as a professional. Your first job is to do no harm, and if you become friends or if you become romantically involved with someone and things go awry, which they sometimes do, that person may quit using your services. They may quit coming to their treatments or their workouts, and in fact they may just completely walk away from being active, and that is certainly causing harm. So be careful about being too personally involved. Now, if you're a person who really likes to bring people together and you're good at it and are balanced and maintain professional boundaries, it may be a strategy that you could consider. And this gets more into public health. Dr. Monica Lounsbury used to teach Kin 250 more from this perspective, and she's now in the provost office, still connected with our department, and she does a lot of work to change things on a political level as well as a community level. She often works with the school system to try to increase physical activity, to bring recess back for grade school kids. But this is certainly an area that some kinesiologists are end up heading toward, because this is obviously a very important aspect of keeping people moving and active and healthy. So remember to individualize and personalize the intervention to where the participant is at physiologically as well as psychologically. Consider providing cues. Remember that priming does work, and although you may think it's a silly thing, we're beginning to see through social psychology that priming is very effective. Make the exercise enjoyable. If somebody hates going to the gym, find something else. Again, just keep it individualized. Your exercise prescription should take into consideration all of the typical aspects as well as what we've talked about. Buddy system works really well, or you can bring people in to create a group and use your behavior change contracts as well as the balance sheets. Offer different things to do. You can use rewards appropriately, and you can use your charts to keep people feeling motivated. Learn how to give feedback. Remember, there's a lot of science behind it, and also you have to develop your own art of feedback. It's not just one size fits all. For places, you might suggest if somebody is more of a home person, that if they have an extra room that's just been sort of collecting stuff that may be their personal space, and have them, maybe put a little TV in there with some videos or something, their workout stuff, and that's their own special place. That can serve to really enhance a person's desire to take care of themselves, make them feel like they're doing something special. Rewards can be used. Remember that goals should be self-set, flexible, and time-based or fitness-based rather than performance-based. Environmental cues, provide them. If your environment is really ugly and doesn't have any music, you might consider adding those components, or teaching people how to focus on things other than the sensations in their body. Small group discussions can be accomplished simply by providing an environment where people can network, or you can structure them specifically. The balance sheet. We want to get support, keeping an exercise journal, and I suppose if we're going to teach people to practice time management skills, we all have to learn them, something I continually work on. So helping your patients or clients even write out their schedule, put in their day timer when they're working out, and working towards better time management can be very helpful. Suggest again that they bring some more meaning, whether that be children, dogs, friends, some type of activity that does tend to elicit also a mental or psychological response can be helpful.